Do you know what congestive heart failure is and how it affects your body? It's a fascinating and vital question, and one we'll be exploring today. Congestive heart failure, or CHF, is a chronic condition where the heart, that muscular organ we all depend on, struggles to do its job of pumping blood effectively. Picture it like a water pump that's not working at full capacity, causing a backlog of water. In the case of our heart, this backlog isn't water, but blood. This means that the rest of the body may not get the oxygen and nutrients it needs to function properly. This condition is termed congestive because the inability of the heart to pump efficiently leads to an accumulation of blood in the heart and surrounding blood vessels. As a result, fluid can build up in different parts of the body, causing a range of symptoms that we'll explore in detail later on. It's important to note that CHF is a chronic condition. This means it's long-lasting and often requires ongoing management. It's not something that goes away after a course of antibiotics. However, with the right care and treatment, those living with CHF can lead full and active lives. Keep in mind that congestive heart failure is a serious medical condition that requires professional medical attention. It's not something to be self-diagnosed or treated, and it's crucial to consult with a healthcare provider if you have any concerns about your heart health. So now that we understand what congestive heart failure is, let's delve into its types. Stay tuned as we continue to explore this complex condition and its impact on the body. Did you know there are different types of heart failure? Indeed, they can be classified primarily into left-sided and right-sided heart failure, which can occur independently or together. Let's start with left-sided heart failure, which is the most common type. This occurs when the left side of the heart fails to pump blood efficiently. There are two main forms of this type, systolic and diastolic. In systolic failure, the heart can't contract vigorously, meaning it can't pump with enough force to push a sufficient amount of blood into circulation. On the other hand, diastolic failure, or heart failure with preserved ejection fraction, happens when the heart muscle becomes stiff and can't properly fill with blood during the resting period between each beat. Now, let's move over to the right side. Right-sided heart failure often occurs as a result of left-sided failure. When the left heart fails, increased fluid pressure is, in essence, transferred back through the lungs, consequently damaging the heart's right side. When the right side loses pumping power, blood backs up in the body's veins. This can cause swelling in the legs, ankles, intestines, and even in the liver. It's also worth noting that heart failure can be acute or chronic. Acute heart failure is a sudden onset of symptoms, which can be life-threatening. Chronic heart failure, on the other hand, is a long-term condition, often resulting from conditions like coronary artery disease or high blood pressure, which we will explore more in the next segment. In some cases, both sides of the heart may fail to function adequately, leading to what we call congestive heart failure. This results in the heart's inability to pump sufficient blood to meet the body's needs, leading to a backlog of blood in the heart and surrounding blood vessels. Knowing the types of heart failure helps us understand the causes better, which we will discuss next. So stay tuned to learn more about what can trigger these different types of heart failure. What causes congestive heart failure in the first place? It's a question that demands a thorough response, considering the complexity of this chronic condition. Let's dive in to understand some common causes of congestive heart failure. One of the primary culprits is coronary artery disease, a condition where the arteries that supply blood to your heart become narrowed or blocked by a buildup of fatty deposits. This impedes the heart's ability to receive the oxygen and nutrients it needs to function effectively, leading to a strain that can result in heart failure. Next, let's talk about high blood pressure or hypertension. When your blood pressure is high, your heart has to work harder to pump blood around your body. Over time, this extra effort can weaken your heart, making it less able to pump blood effectively and leading to heart failure. Another common cause is heart valve disorders. Your heart valves regulate the flow of blood through your heart, but if they're damaged or defective, it can disrupt this flow. This disruption forces your heart to work harder, which can lead to heart failure. Last but not least, we have cardiomyopathy, a group of diseases that affect the heart muscle. These conditions make it harder for the heart to pump blood to the rest of the body, and can be caused by a variety of factors, from genetic disorders to viral infections. These are some of the most common causes, but it's important to note that many other conditions and lifestyle factors can contribute to congestive heart failure. It's a complex condition with a multitude of contributing factors, and understanding these causes is the first step towards effective prevention and treatment. These causes often lead to noticeable symptoms, which we will explore in the next segment. How would you know if you or someone else might have congestive heart failure? It's a question that bears significance, given the nature of this condition. Now let's discuss the typical symptoms that could suggest the presence of congestive heart failure. Perhaps the most common symptom is fatigue. This isn't your run-of-the-mill tiredness after a long day. It's a persistent kind of exhaustion that doesn't improve with rest. The reason? Well, when your heart can't pump blood efficiently, your body doesn't get the oxygen and nutrients it needs, leading to this chronic sense of fatigue. Another sign is shortness of breath, especially during physical activities or when lying flat. This happens because the heart struggles to keep up with the body's demand for oxygen-rich blood, resulting in breathlessness. In severe cases, this shortness of breath might even wake you up at night. Now let's talk about fluid retention or edema. This can cause swelling, particularly in the legs, ankles, and feet. It might also lead to rapid weight gain and a feeling of fullness or bloating in the abdomen. This occurs because when the heart doesn't pump efficiently, blood can back up into your veins, causing fluid to accumulate in your body's tissues. Lastly, there's what we call exercise intolerance. This means having difficulty performing physical activities that you used to do without any problem. It's not just about feeling winded. It can also involve feeling lightheaded or dizzy during physical exertion. These symptoms, of course, can be associated with other health conditions too. However, if they persist or worsen, it's crucial to seek medical attention. Recognizing these symptoms is the first step towards diagnosis, which we will discuss next. How do doctors diagnose congestive heart failure? Let's dive into the world of medical diagnostics. When a patient presents with symptoms suggestive of congestive heart failure, like breathlessness or swelling in the legs, a series of tests are usually initiated. The first step is often a physical examination. This allows doctors to check for physical signs of heart failure, such as fluid retention and an irregular heartbeat. However, physical examination alone is not enough. To get a more detailed picture of the heart's condition, a chest X-ray is commonly performed. This imaging technique allows medical professionals to view the heart and lungs, checking for any abnormalities or signs of congestion. But the diagnostic journey doesn't end there. Echocardiography, often referred to as an echo, is another crucial tool in the diagnosis of congestive heart failure. An echo uses sound waves to create a detailed picture of the heart's structure and function. It can help determine how well the heart is pumping blood and whether there's any damage to the heart muscle. Blood tests also play a vital role in the diagnosis of congestive heart failure. In particular, B-type natriuretic peptide or BNP levels are closely looked at. BNP is a hormone released when the heart is under stress. Elevated levels of BNP in the blood can be an indicator of heart failure. Diagnosing congestive heart failure is a complex process that requires a combination of different diagnostic tools. Each method provides a piece of the puzzle, contributing to a comprehensive understanding of the patient's condition. Remember, early diagnosis is key in managing this chronic condition. So if you or someone you know is experiencing symptoms that may indicate heart failure, be sure to seek medical attention promptly. Once diagnosed, a healthcare provider can suggest a course of treatment. So how do we treat congestive heart failure? Well, there's no one-size-fits-all approach, but rather a combination of methods tailored to each patient's unique condition. The first line of defense often involves lifestyle changes. This can include a heart-healthy diet that's low in sodium and saturated fats, regular exercise, maintaining a healthy weight, and quitting habits like smoking. It's all about creating an environment for your heart to function at its best. Medications also play a key role in managing congestive heart failure. Diuretics, often known as water pills, help reduce the body's fluid levels and alleviate swelling. ACE inhibitors work to lower blood pressure and decrease the heart's workload, making it easier for the heart to pump blood. But what if lifestyle changes and medication aren't enough? In severe cases, surgical interventions may be necessary. This can range from installing devices to help the heart pump more effectively to more drastic measures such as a heart transplant. These procedures are typically considered when other treatment options have not improved the patient's condition. It's important to remember that treatment for congestive heart failure is a marathon, not a sprint. It requires long-term commitment and regular follow-ups with healthcare professionals to monitor progress and adjust treatments as necessary. The goal of these treatments is to improve the heart's ability to pump blood, alleviate symptoms, improve quality of life, and increase lifespan. And remember, early detection and prompt treatment are key factors in managing this condition. The effectiveness of these treatments often influences the prognosis, which we will talk about next. So what can someone with congestive heart failure expect in the long run? This is a question that resonates deeply with those living with the condition and their loved ones, and it's a question we're here to answer. The prognosis of congestive heart failure varies widely, dependent on factors like the individual's age, overall health, and the severity of their condition. Some people may live many years with the condition, while others may face a more challenging course. But here's the good news. Early diagnosis and effective management can significantly improve the prognosis and quality of life. With advancements in medical technologies and treatments, the 5-year survival rate for those diagnosed with heart failure has significantly improved over the last few decades. This is a testament to the power of early detection and intervention. The cornerstone of improving prognosis is, of course, effective management. This might mean lifestyle changes such as adopting a heart-healthy diet, getting regular exercise, and closely monitoring symptoms. It could also entail taking prescribed medications like diuretics or ACE inhibitors, which help the heart function more effectively. In severe cases, surgical interventions such as heart transplant might be necessary. While this may sound daunting, remember that these procedures have the potential to significantly improve both life expectancy and quality of life. Importantly, each individual's journey with congestive heart failure is unique. That's why it's crucial to have regular checkups and maintain an open line of communication with your healthcare team. They can provide personalized guidance based on your specific condition and needs. Living with congestive heart failure might seem overwhelming, but remember, you're not alone. There's a vast network of healthcare professionals, support groups, and resources available to you. Armed with knowledge and proactive management, you can lead a fulfilling life while managing this condition. Congestive heart failure is a serious condition, but understanding it can help in managing it effectively. So let's summarize what we've learned about congestive heart failure. It's a chronic condition where the heart can't pump blood effectively, leading to a backlog in the heart and surrounding blood vessels. We've talked about 2 types of this condition, left-sided and right-sided heart failure, which can occur independently or together. We've also discussed common causes, such as coronary artery disease, high blood pressure, heart valve disorders, and cardiomyopathy. Symptoms to look out for include fatigue, shortness of breath, fluid retention, and exercise intolerance. Diagnosis involves a physical examination, chest X-rays, echocardiography, and blood tests. Treatment options vary from lifestyle changes like diet and exercise to medications such as diuretics and ACE inhibitors, and in severe cases, surgical interventions like a heart transplant. The prognosis for congestive heart failure can be improved with early diagnosis and effective management, emphasizing the importance of regular checkups and a heart-healthy lifestyle. Remember, knowledge is power, especially when it comes to your health. Always consult with a healthcare professional if you have concerns about heart failure or any other health issues.